If you read the new Make America Healthy Again executive order and did not have the sense that they are just trying to distract us away from things that will actually improve the health of Americans, then this video is for you. And there's no judgment or anything. I genuinely think it's a good learning opportunity because if you read the document, there's all this language calling for fresh investigation into the root causes of chronic diseases in America. Guys, this is like saying we should look into the root cause of why objects will fall from a building if you drop them. Root cause is gravity. We don't need more studies into that. Root causes of chronic diseases in America have been well described by decades of public health research, including huge trials like the Nurses' Health Study, the Global Burden of Disease Study, the Harvard Alumni Health Study. These and many other studies suggest that it is things like poor diet, low levels of physical activity, tobacco use, excessive alcohol use, and really importantly, poverty and all of the social determinants of health that come along with it. For example, the US Burden of Disease investigators found that poor diet was the #1 cause of death and disability in the United States. The second was tobacco use. In response to this, public health experts have created a wide variety of guidelines to help Americans be healthier, but unfortunately, the vast majority of Americans do not meet these guidelines. In fact, one study found that less than 3% of all Americans actually met the 4 pillars of a healthy lifestyle as these investigators defined it. But the authors of this executive order want to act like we need to start this new investigational enterprise in order to distract us away from what they're actually doing, which is trying to cut funding from important health programs like Medicaid and the Supplemental and Nutritional Assistance Program. By the way, while also allowing billionaires to take advantage of up to $1 trillion of tax loopholes every single year. And it seems to be a distraction away from actually doing the work, implementing the public policies that we know would actually make America healthier. Things like realigning agricultural subsidies to favor the health of actual people instead of big agriculture and corporations. Or things like introducing food as medicine initiatives, community investment in infrastructure to promote physical activity, or a comprehensive tobacco reduction program that could actually increase tax revenue for other initiatives. And most of all, to try to expand access to healthcare, not trying to decrease it by Medicaid budget cuts. One of the most important things I think that we need to be able to do in a democracy is realize when we are being misled, and this is one of those times. There's also some crazy verbiage in there about investigating the threats of psychiatric medications like SSRIs, which is ludicrous and a story for a different video.